Hello and welcome to this month's brief video blog. A long time ago, I had a conversation with a patient, and we were talking about home care and what she could do for her problem. And I said, well, what have you been doing for it? She said, well, I've been using ice, heat, depends. And I said to her, well, putting depends on it isn't going to do you any good. But let's talk about whether the heat or the ice would be appropriate. So this month's topic is, when do you use heat and when do you use ice? Let me first say that there is no absolutely certain answer to that, but I can give you a 95% accurate rule of thumb. A little background first. Most of the pain, the vast majority of the pain that we see here in the office is coming from a combination of low-grade inflammation and or tight muscle. So it's either muscular pain or it's inflammatory pain. Now, inflammation is your body's response to injury. You bang your thumb with a hammer and your thumb swells. It turns red. If you feel it very carefully, it is a little bit warmer than the other thumb, and it hurts. Those are the hallmarks of inflammation: swelling, redness, pain, and heat. So when something is inflamed, the pain that you will feel with that tends to be pain that you can point to with one finger. If someone asks you, where does it hurt? You could take one finger and say, it hurts right there. And it tends to be the kind of pain that when you feel it, makes you gasp or tense up like that. Pain of that type is usually caused by inflammation. On the other hand, pain that is caused by tight muscle tends to be the kind of pain that you need your whole hand to show somebody where it hurts. It hurts all over here. And it's the kind of pain that makes you want to groan. Oh, it's a groaning type of pain. That's a pain that wants heat. So, rule of thumb, one finger, gasping pain, ice. Whole hand, groaning pain, heat. If you're not sure, if it looks like a tie, ice always wins, because you won't hurt a problem that wants heat by putting ice on it. You can, however, hurt a problem that wants ice by putting heat on it. Putting heat on an inflammation is to some extent throwing gasoline on a fire and making the fire worse. When using ice, you don't want to use ice continually for a really long period of time. You want to chill the tissue and then allow it to warm back up again, then chill it again. So we recommend somewhere between 15 and 20 minutes of ice on, then off for another 40 to 45 minutes. So that out of an hour, you have it on for 15 or 20 minutes, then you let it rewarm, then you reapply it again, and so on. As long as you keep that rhythm, you can't overdo it. I often tell patients, if it's reasonably convenient, ice it 15, 20 minutes out of every hour that they're awake. Although at least 3 times if you want to make some kind of impact on it. Heat, far less restricted. You're not going to hurt yourself by heating something, provided you're not applying enough heat that you're going to burn yourself. So as long as the heat stays within a short of burning range, you can use heat as much as you want. So that's the scoop on heat and ice. A couple of other small issues. It's almost time to congratulate Dr. Berard on his new baby, coming any day now. He's going to be out of the office for a short time following that. The office will be closed on the 4th of July. We don't, as you probably know, we don't take the smaller holidays, the President's Days and Columbus Days and so on, but we do take Memorial Day, Labor Day, and the 4th of July off. So the office will be closed on the 4th of July. I will be out of the office for a couple of weeks in July for a vacation. But other than that, the gang will be here to take good care of you. Thanks for your attention, and we hope to see you soon.